Hey, good morning, everyone. Welcome to session 5B, Extreme Events, Climate Change, and Health Risks. I'm Susan Anenburg from George Washington University, and I'll be moderating today. We have an excellent lineup today, but we do have one change, which is that Andrew Sayer, who's listed as the final speaker in this session, is actually speaking in the other session. So minor typo. Oh, sorry, the one after this. Okay, 6A. Okay. I was wondering why Andrew is not in the other room. Okay, fantastic. Thank you for joining us, Andrew. Well, it is my pleasure to introduce our first speaker today, who is Susana Adamo from Columbia University. So, Susana, your slides are already up. And you should use this microphone for the Zoom people.
Can you hear me? Okay, thank you. Apologize for my voice, but it's all I have at this point. So very happy to be here. I was in Houston, but not in Madison, so it's very nice to see all of you again. And this session is a little different from the one that we have had before, because now the focus is on climate change and extreme events and how that could also affect health. In many cases, because it's also affecting equality. But so what I want to present today is these heat trends and socioeconomic vulnerability in New York State. We know the definitions of climate change, as I wanted to have some context. And I like to use more the UNF definition because it's the institution or the framework where actions take place. But the IPCC provides a scientific basis and attribution. The UNSCC said that focus specifically on human activity and anthropogenic climate change is the one where you have stakeholders and where you have policy action and treaties and so on. But however, the last iteration of the IPCC, this is the IPCC report 6, group 2, has a very extensive chapter on climate change, health, and human well-being. And I like very much how simple this is, and at the same time it's incorporating things that were already available. So we have the classical risk helix with the hazard, the vulnerability, and exposure, and the different factors within those. And these are the ones, they call it pathways. These are created pathways that impact health in terms of sensitivity outcomes, but also in terms of system impact. I think these are very important, and we saw this during COVID, how the health system could be strained and create an additional burden, and the same with the food system and the livelihood system. And of course, this then is a recursive impact and go back to the helix and start again. So when I want to show, or I want to focus today is on heat specifically, in elements that had to do with vulnerability and with some elements that had to do with exposure. And I understand exposure as the coincidence in space and time of the hazard and the different elements that could be human, it could be household, or it could be livelihood. It's a little different from other disciplines. So for the New York State, I'm plotting here the trends in temperature. This is from work from Cascade Tulhosky, and changes in social vulnerability and exposure. And this is within one of the HAQAST 2021 projects investigating spatio-temporal patterns at the nexus of air pollution, climate, and public health over the Northeast USA, the PI Arlene Fiore. So starting with the heat trends. Cascade has been working with daily maximum temperature and daily maximum vapor pressure deficit with data from Chris Kalima Group at Oregon State University. He can be reached on this particular email, and he'll be very happy to explain every single detail of the work that has been doing. He has been working extensively on heat at different scales, global scale, the US scale. And one of the elements that I think is extremely important is this data that he's creating now. It's like 4 kilometer spatial resolution. Because one of the problems with the heat data is that the resolution not always is appropriate for health, because there are 2 force to match any kind of attribution that could be done for health systems or for humans. So these 4 kilometers is better. And he was using relative humidity, but also was using now heat index instead of wet bulb, because the heat index is the one that is related to the warming and particularly in New York. And what he did in this particular slides, map the area average daily to the census boundaries for New York State from 1981 to 2021. And he have here the two different formats. On the left, we have the census tracts, and then on the right, we have the 4 kilometer grid. And I'm going to, and I think this is important, I mentioned this at the end, but the format is important because the 4 kilometers, as well as to be census tract and no grid, it was a conversation with the stakeholders because they prefer to have the census boundaries. And this is the comparison between two decades, the 90s and the last decade. And what he concludes is that on average, the hot humid heat has been worse in the last 10 years, comparing with the 80s, with approximately 1 degree across all census tracts, but with a large spatial heterogeneity in terms of which areas are warming. So the next step that he is working now is to determine what are the areas that are heating fast, coast or interior cities or the rural areas, and also how to combine this with the health data. I also want to talk about the social vulnerability and particularly using the social vulnerability index. This is the social, it is an index created by the CDC and the ATS-DR to identify communities that may need support before, during, and after disasters. So it's very focused on this particular hazard. It's talking about relative vulnerabilities. It's not assigning an absolute score, but the relative position of the different census tracts related to other census tracts is based on census variables on the American Community Survey and the population census, and has at this point, like 6 different iterations. The last one was in 2020. And see that the Socioeconomic Data Application Center, this is one of the NASA DACs, had developed a gridded version of the CDC Social Vulnerability Index at 1 kilometer resolution. That's the one that I'm going to be showing here. The variables are combined in 4 domains: socioeconomic status, household characteristics, racial and ethnic minority status, and the household type and transportation. I'm only going to show the overall index, but I think that is very important if we determine that there are some areas that are in very bad shape according to this social vulnerability index, to go and deeper into how these different domains contribute, because that could make very different types of social vulnerability. So these are the 2 grids for 2000 on the left and for 2018 on the right. This is using the grid. And there are some changes. They are not very easy to see directly, but just a very quick difference between them. We have areas that have changed their relative position within the rank. Some of them are in lower, so I mean that they are in better shape, while others are not. But there doesn't seem to be a particular pattern, except that in the New York area, the patterns are more defined, the colors are more intense. But that could also be an artifact because the census tracts are very small. There's a lot of them. So that's a problem of working. Sometimes we need to consider that also. And finally, I want to talk about a community estimate for this. HAQAST was released a couple of weeks ago, and it's an experimental release. And it's talking about community resilience. The community resilience estimate has been around for at least 2 years. looking at capacity of individuals and households with the community to absorb the external stresses of the disaster. And the ones that were created for heat are talking about social vulnerability in the context of extreme heat exposure and add other factors to the one that were already included. And some of those factors are the ones that are mentioned in the first, particularly household quality and communication. It was developed by the U.S. Census Bureau in collaboration with Arizona State. And the one that is now available is 2010. And it was used information from individuals and households from the 2010 American Community Survey and the Population Estimate Program of the Census Bureau. And it's based on 10 different factors. And these factors are the ones that determine the rank of each of the different census tracts. They are very, very wide. They have the financial hardship all the way to transportation, to communication, age, and disabilities, language, and household quality. That is one that is already mentioned. So there is 10 of these risk factors, and using that, they create this classification. So this particular one is mapping the rate of individual with 3+ risk factors. One of the problems that I have with the data set is that doesn't say which are the factors. I don't know if it's going to be released later, but at this point, it just said 0, 1, 2, or 3 and more. So there's not really a way to know what are the factors that are contributing to this. And again, that could make a huge. So the final remarks, there is increasing availability of the reference socioeconomic and demographic data to address the pathway that are mentioned in the IPCC, linking the climate change with the good health. The indices summarize information. They are extremely important because of that, because all those elements are multicausal and multidimensional. But I think it's important to consider the input data, the raw variables, to actually know the nature of the different types of social vulnerability. And because they are using a American Community Survey, it's important to also consider the margin of errors. And both the SBI and the CRE include variables that look at the margin of error of the different variables. The format, as I mentioned, is important in order to communicate with the stakeholders. And my next step is to connect the social vulnerability with the air quality that are being prepared by other members of the team. Thank you.
Okay, great. Thank you so much, Susana. And I have the wrong paper, so let me put the right paper. We will move on to our next talk, but before that, let me clarify that checkout is indeed at 12. So sorry for that. The checkout is at 12. And we will turn next to Stephanie Moraga-McHaley from the New Mexico Department of Health.
Morning. I really need to thank Dr. Adamo. She's really covered all the technical aspects that I am not going to cover with this talk, especially with regards to the Social Vulnerability Index. I'm with the New Mexico Environmental Public Health Tracking Program, which is in the Environmental Health Epidemiology Bureau in the Epidemiology and Response Division, New Mexico Department. Okay, thank you. So we have what we call in our department the crisis of the day. And most recently, it wasn't the wildfires, it wasn't extreme heat, it was flooding. And this is a picture from last week. This is the Jemez River, which rose about 5 feet in a day. It was from April 6th, the temperatures were in the low 50s, the highs were. And on the 12th, they were approaching 80. And snowpack in the Jemez Mountains this year was about 500% of normal, which is a lot for New Mexico. And also in this area, there was wildfires, and I'm going to show you more about the wildfires later. But so you can see that in New Mexico, climate is a moving target. And when we think we have a handle on one crisis, here comes another one. So the fire season in New Mexico was the worst in recorded history. And the biggest fire was the Calf Canyon, which merged with the Hermit's Peak fire. It started very early in the season and continued till mid-June. It burned about 430,000 acres. In the same year, we also had the second biggest fire in New Mexico ever. And that was the Black Fire, which was down in the Gila Wilderness. So we were pretty much covered in fire for the entire summer season. And this is just a list of the fires that were going on at that time. This shot is in Taos. It's from the parking lot of my daughter's coffee shop. And that's not a cloud, that is pure smoke. And we were very concerned that it would come into, that the fire would move into her neighborhood, which is just kind of south of Taos. Fortunately, it didn't happen. So the Department of Health participates in a big smoke coordination communications effort. And this effort is takes place with the Forest Service, National Weather Service, Air Quality Bureau, State Forestry, and others who might need to be participating. And we meet every day at a certain time and review air quality forecasts and try to determine where we need to alert people. And it's not an easy thing to do, especially in, when you have mountains and shifting weather patterns. But we were busy pretty much every day for a good part of 2 months. This is our main product, which is the New Mexico Environmental Public Health Tracking data portal. If you're not familiar with the Environmental Public Health Tracking Program, there are about 33 states and entities across the country that are funded to host environmental and health data on a portal funded by CDC. And on this portal, we have data about heat-related illness, cold-related illness, carbon monoxide poisonings, heart disease, birth defects, just a whole host of environmentally related illnesses. And we also have climate, air quality, and water quality data. We also host a variety of information on health protection information, especially on climate. And it's a good outlet for our data. And here's some of the data. Here's some death rate data on air quality related diseases, respiratory diseases, asthma, and COPD. And you can see they took a big jump up in 2020. And this is, a lot of that probably has to do with the COVID pandemic. But we also noticed in the same time period that we saw a jump up of PM 2.5 average concentrations across the state. And this is only through 2021. So we are really interested in seeing 22 data. The map in the lower right is the areas where there are EPA monitors. This is the 5th largest state in the country, and we only have 5 monitors. So or 5 areas where there are monitors. I think there's multiple monitors in some of those locations. Heat-related deaths are pretty minimal, but they are really trending up. You can see they can occur in any area of the state. These are age-adjusted rates. And they happen in the north, they happen in the south. And since 2013, there's been a 10-fold increase in the numbers of heat-related deaths in the state, jumping from about 3 to 30. So we're looking at that closely. This map is from the heat.gov, if you're familiar with that. And it overlays the social vulnerability index with heat projections. And this snapshot is for 2050. And you can see in the, I don't know if you can see it too well, but number 4 and number 6 are both counties in New Mexico that are some of the top most vulnerable counties in the country. Luna County and Cibola County. Cibola County borders the Navajo Nation, and Luna County is a border county. So there's really some extreme vulnerability in those areas. And we are establishing partnerships with entities in those counties. So what's our plan for action? We want to focus on communities that are most in need and those that are most at risk. We can't cover it all. We want to build plans with and not for communities. We also want to continue to assess and model potential health outcomes in climate events. We've done some modeling on heat-related illness. And we want to assess outcomes of climate policy on health. We've enacted several policies, especially around the reduction of fossil fuel and pollution. So we'll see what happens with that. And we want to continue our statewide communication and outreach efforts. And we'd like to expand to include surveillance of climate-related infectious diseases, because we count the numbers, but we're not doing much with them. So I want to thank you for your time.
Okay, great. Thank you, Stephanie. And we will move on to our next presenter, who is HAQAST PI Daniel Tong from George Mason University.
Good morning, everyone. Thank you for coming to our session. I think it is a very exciting session. I'm going to switch gear a little bit, talk about dust storms and highway safety in the United States. This is a collaboration between George Mason, University of Texas, and also Free University of Berlin. So over the past 3 years, I have been very lucky working with a large group of experts. We have 28 members in the team funded by the NASA Health and Air Quality Program, trying to map out all the health and safety effects of dust storms in the Pan America region. It started in the United States, but then people in South Africa, America, and Central America joined us. So WMO and WHO and also PAHO, they chimed in, they asked us to produce this map. So after 3 years of hard work by this team, we finally got the map. It's showing all kinds of effects that dust storm have on our population and also the ecosystem. They including the health impact, such as asthma, fungal infections like valley fever, and also premature deaths. But that is not always bad. It provides critical nutrients to the ecosystem like the open ocean or Amazon. But at the same time, it spread pathogens, pollute our water and food, and also sometimes, in the case of the United States, transporting the radionuclides from the historic nuclear weapon test sites to communities, and also reduce the solar generation. And dust is also a major safety hazard for roadway transportation, for aviation, also for marine navigation. So my focus here will be on the roadside safety. You wish you will never get into a dust storm because that's very little you can do about it. You can keep driving, you can drive into other people's car, you can stop, but people can hit you from behind. So there are many accidents every year. This is at the lower bottom. This is a picture I took on one of the field trips I had in Arizona. It was saddening me a lot to see so many memorials on the roadside. So I was asking myself, how many people were killed by dust storms in the United States? It sounds like, because I asked this question after I saw those memorials, but if you look at the natural hazard statistics, which is a widely used public platform and the media, and also sometimes people use that in lawsuits, then you find that's a zero record, like 2017 in this case. However, that does not sound reasonable to me because I have a large circle of friends who constantly send me emails about dust storm news. Just in one case, we have 6 people killed in one accident. And in the same year, the natural hazard statistics showed 0. So there's definitely something fishy here. So I was very lucky to have a summer intern, Irene Feng, join me a few years ago. We worked together trying to do a comparison of 3 data sets. One is in natural hazard statistics, which is commonly used. But we dig into the storm events data set, which is the original source from which the hazard statistics was derived. And we also look at the police report card from the Department of Transportation Highway Patrol, or the fatality analysis report system, or FAST. We found that's a very different result. So the natural hazard statistics, the official data portal showing 0 to 5, on average you have 1 death per year. But if you look at the stormy data, they report more deaths. The reason that the natural hazard statistics did not use their original data set because they put a lot of dust events into high wind events. And also that's a problem with that data set is they crowdsource the data set. So people report it from all sources, like the weather spotters and the media, law enforcement, but it's not consistent. People is not there 24/7 reporting accidents. So the police report actually is way more reliable because every time there's a fatal crash, they are required to file a report. At least for most states. We find that there's a lot of more people killed by dust storms. And we also think that's not a good idea to put a dust storm into a high wind event because dust storm events is different from a high wind event. You add dust into the air, so it's not a pure air anymore. It's not a weather hazard anymore. You also reduce the visibility during the dust storms and people panic. So that's have a psychological impact that cause people to make the wrong decisions. And then also the fine powders deposited to the road surface is going to reduce the traction of the road. Just like after snow, you put a salt on it, you take a longer distance to brake. If you forget that, you got an accident. So for those reasons, we have suggested NOAA and they should change the way it reports dust fatality. Where do you see those fatal accidents? It can happen everywhere, right? I was very surprised when I first saw this map. Originally, I thought that only in deserts and places frequently heard about dust storm, you have fatal accidents. But actually, it's across the state. You have that in the Western US and also in the Corn Belt and also even the Eastern seaboard. There are, well, one thing I want to take you back is we actually have spent several years to carefully check each accident. Just make sure this is not false alarms. For example, we use satellite data. This is a Moody's truth image to check all the accidents. And if we do not have direct measurement of the dust storm like this one, which is over Washington State, and we look at the land use data, and also we look at the social media. So we did a lot of digging. on that and come up with this data set. We found that there are several hotspots, like this one between Phoenix and Tucson. There are 10 miles on Highway 10. If you ever drive in between Tucson and Phoenix, you'll be very careful. Within that 10 miles, they have hundreds of car accidents. Some kill people, some people just got injured. So that is the 10 miles in the United States. And also in New Mexico, in Stephanie here, we also have another hotspot, Notisburg. It's a dry lake bed. That's within like a few miles. You have a few very large accidents, like one case have 7 people killed, another case have 6 people killed. So Arizona Department of Transportation and New Mexico Department of Transportation are working very hard trying to mitigate. They spent hundreds of $1 million working on that. So I also showed you earlier that we can have storm everywhere, right? It's very surprising. But if you really pay attention to news, like for example, there's a Highway 10 in Florida was closed by dust storm. That's because you do not need a desert. You just need a land not covered by any vegetation, and you have a high wind. You can generate a dust storm. You can generate dust storm from construction site. And the dust storm, the term of dust storm is a wind-blown dust event that reduce the visibility to less than 1 kilometer by the WMO standard. By the National Weather Service, it's a quarter mile. So if you meet that criteria, it's a dust storm. Well, when did that happen? We look at the 10, 11 years data trend, because after 2007, it started to adapt and it's measured to add the dust as a weather type. We started 2007. Now we just got 2017 data processed. We're seeing an increasing trend, but I will not, put my money into it. It's too short to tell the trend. And then in the summer, actually, you are seeing less fatality because that's American monsoon season. It's surprising to see the highest fatalities on Saturday. That's because America is a country on wheels, on trucks, right? So most deadly accidents involved at least one commercial truck, semi-trucks. So the trucks, they actually they drive more frequently at night and on weekends. And then the peak hour is 5 p.m. That's because most American dust storms occurred around that time, and also this is a high traffic hour. So the last thing I want to show here is do a comparison of the dust fatality and the fatality of other famous weather hazards, such as hurricanes, thunderstorms, and wildfire. Right? In most of the years, you can see the dust, which is the blue column, causing a comparable life loss, very major ones. So it's very surprising to us. Okay, so I want to offer some tips just in case you are unfortunate or got into this situation. So what do? The first thing you do is check around, not panic, check around. See in front of you, behind you, and then on the side. And then you should look for a safe place to pull off the paved portion of the highway. That's very important. Also to turn off your light, because in a low visibility conditions, your tail light is going to be a guide for other people to follow you, so they can hit you from behind. And for the same reason, you should take your foot off the brake, so that brake light will be off too. And you should stay inside the vehicle, keep the seatbelt on, and wait just for the storm to pass. The good news about the dust storm in the United States now, mostly short-lived. They're not going to trap you for days. Okay, and if you cannot remember all of this, Arizona Department of Transportation put this nice term here: pull aside, stay alive. Okay. I will wrap up here. We find that there's a misconception in the public messaging about the dust fatality. We find that 20 times more fatalities caused by dust storm, which is something that I think we should broadly sharing with the public. The dust storms actually are more dangerous than you thought. And this can happen across the nation, not just the desert area, and causing a comparable life loss, and your poor side stay alive. Thank you very much.
Hadn't seen a lot of those results, so very interesting. And we will turn to our final speaker today, who is another HAQAST PI, Chris Uejio from Florida State University.
Thanks, Susan. Hi, folks. So I guess I would just start off by saying extreme, arguably, right? road weather and extreme heat are the top killers of people, weather-related hazards in the United States. And if you look at something like excess deaths, which I know is a bit of a statistical construct, but essentially kind of like with COVID, just the total number of additional people that have died compared to some sort of reference period, you get about something like 8 to 10,000 additional people dying of extreme heat in the United States. So just so we're on the same page. Okay. So here, really just some updates. Some of this is not, I mean, a lot of it, to be honest, is not earth shattering, but just, and some of it shows you my hand in terms of some of the major challenges that we face, which are at the same time somewhat esoteric, but for nonetheless stuff that we're working through. Okay, so really hat tip to my colleague, Uejio, who is, I've sort of tasked her with this one, and but I ended up presenting her work. But essentially we have this problem where the temperature that we experience, the air pollution community calls that nose level, but let's say hypothalamus level for extreme heat, is different from what we can see from space, right? And that's, you may see these images, which are very striking, perhaps on social media, of surface skin temperature or land surface temperature. And you might see some very large absolute magnitude values of how hot that may be. And in some ways that's very striking, but we know that that's not the same in terms of risk, and based on a much wider body of evidence of how that's related to adverse health outcomes. So essentially, in short, we're trying to come up with a better way of connecting, largely by using Earth observations through satellites, and also by using ground observations to truly kind of come up with a better measurement of what people are experiencing for things like these vulnerability assessments that you folks are doing. So what Uejio has ended up doing, though it's not a MODIS, she ended up using a vertical profile for MODIS. It's not a vertical sensor, or it's maybe not optimized for that, but it has sort of the right trade-off between spatial resolution and having some vertical profile information. To really get at some of the lower planetary boundary layer conditions. And to be honest, a large contribution to that will be sort of weather stations. So as many of you know, there's not a high enough density of NOAA, National Center for Environmental Information, weather stations to quite tease out the structure of the urban heat island, but not unlike what the air quality community has been doing with purple air or low-cost crowdsourced sensors. There is a sort of burgeoning network of private weather stations from a variety of providers that we're essentially scraping for this project. Okay, so essentially that's it in a nutshell. Just to walk through sort of where the vertical information might come in. This is, I think many of you might be somewhat familiar with Chicago. I'm going to start with B because that's what I understand the best. So if we're taking a somewhat simulated vertical profile, here we can start to see where the wind direction here from B, if you're going from the southwest to the northeast across Lake Michigan. I want to make sure it's not too early in the morning. You can see the impact of the wind direction, really cutting off that sort of, or evening out and the circulation during this aloft, evening out the temperatures here in this vertical transect, as well as the structure in the vertical direction of the urban heat island, as well as spatially here. Essentially, there is sort of a bit of a downwind effect, if you will, of the urban heat island on downwind rural areas. So how can we try to get at this using satellite data? I think one thing that Uejio's tried to do is, instead of just doing a sort of a binary classification, is it urban, is it not, is really trying to get at the gradient of urban or impervious surfaces and seeing how that influences the urban heat island structure. So some of the things that she's and her team has discovered. here, so I'll try to walk us through this bit. These are actual observations, but during the daytime, here, if you classified through some sort of systematic system, which I won't go into too much detail, but sort of the hottest days, you can sort of say those are kind of like heat wave days. And then relatively hotter, maybe that's like 90th or 90, 85 if percentile days, or normal conditions. Here during the daytime, we see similar slopes, if you will, or similar relationships between urban land use intensity and air temperature. During the nighttime, there's a few things to note. First, the signal, the difference between the nighttime and the daytime urban heat island, which many of you know in the room know, is much clearer to detect at the nighttime. Other things to note is during these periods, the hottest periods of time during heat waves, the exposure of and the influence of the urban heat island is actually less. I mean, it actually evens out conditions, at least in this low steady location, given there's a ridge of high pressure, that exposures are somewhat similar in both the rural and urban areas during heat waves. Here, so that was sort of an interesting finding, but because of that, then depending on the steady location, if there is a different relationship between heat waves versus just what I would call everyday hot summer exposures, we will end up using sort of different correction factors or different ways of estimating those, because stated another way, the pattern of the urban heat island and the exposure for human health may be different depending on what you're looking at. Okay, more to the everyday things, and you know, to be honest, I could have presented something more finished, but partly to commiserate, this is essentially what we're stuck at. We're about 10 to 15 years behind the air quality community, and in which I have, with like deep respect and some envy, to having sort of unified data sets, having nationwide numerical model simulations for things like heat. We're unfortunately not there yet, but it is sort of our long-term goal. So really, we're just at that stage of trying to get enough ground observations to really provide enough corrections to the satellite observations, as well as. So as I mentioned, there was a couple private weather station networks here that we're looking at. Weather underground, which you literally have to scrape, and NetAtmos, which does provide researchers with free access. It's going to sound strange, but essentially a normal query, because it's sort of rate limited, would have taken a long time to gather a lot of data. And essentially then Rob, whose work I'm presenting, came up with an API composer, which I didn't actually know you could do, but essentially to distribute those calls to speed up that process about 5 to 10 times. So then obviously then you want to resample and aggregate the data, some sort of quick visualizations. This is switching geography, sorry, on you to Orlando, Florida, but just as one of the areas we're also trying to do this in. We can start to see how just the density of those stations allows us then to pick up a little bit more of those urban land uses more consistently over time. And that plus the satellite images, then we're starting to get a large enough sample of those conditions, at least during clear skies, to have a better sense of what heat exposures are. And then of course, when you're using crowdsourced data, you have to do some quality checks and assurances, spatially and temporally. That's it for me. Thanks for your time.
Great, thank you, Chris. If you could stay up here and we'll bring our presenters back up and we'll have a Q&A session. We have, I forgot my clock, but I think we have about half an hour or so. So I had, maybe I'll just kick it off with one question while we're assembling. And this is for everybody. There's various risks that you all talked about, various climate sensitive hazards. And I know like in New York, you talked about heat and air pollution, as well as social vulnerability. In New Mexico, you talked about flooding and wildfires. We have heat and dust as well. And dust is related to some of the other hazards that Daniel showed on that nice looking map. You know, as we think about this warming world that we're living in, we're not exposed to any of these hazards in isolation. And so how do we think about presenting information on compound hazards or multiple exposures, at least simultaneously? People who are exposed to heat and wildfire smoke at the same time, or people who are exposed to flooding events and wildfires at the same time. Is that something that we're accounting for already, or what needs to happen to be able to address that more?
Yeah, I just want to throw out my 2 cents. I think compounding effects definitely is happening. And we are seeing this from wildfires, almost it's well connected to dust, driven pretty much by the same large scale climate system changes. And then also, for the other socioeconomic factors that either happen independently or related to climate change. I think those are coming together. It'll be nice we can map out. So the effort we are doing right now with WMO and WHO is trying to map out all the vulnerabilities that impose on us. I think we could also do the same thing for wildfire, for flooding, for heat. Will be interesting to see how they allocate and what factors are common, what factors are different.
Yeah, so we really were challenged with this during COVID especially, and we had to really craft our messaging regarding going to because there were fires during COVID as well, but we had to craft our messages on how to stay safe in shelters during high smoke density. So yeah, it is a challenge, and you just have to consider all the possibilities.
Yeah. That's what, when I was mentioning the importance of knowing not only the overall index, but also the other index, is because different hazards you can raise adventures to the effect, really impact in different ways. So different characteristics, and we are talking about data here, are important on that. So the more clear example is aging and the older population. There's very specific situation and risk hazards that affect them more than others. But there are others that are more like income or lack of communication or lack of that affect the other populations. And the idea is to start looking into multiple hazards in time. And you mentioned they're all combined. You have middle term hazards that are combined with extremes. You have heat waves combined with hurricane. Or you have heat waves combined with that you mentioned that heat wave combined with melting landslides. So those are becoming more common, and they need to be considered. It's not going to be only hurricane. Because the hurricane, the heat, and the flooding, and the disease, and they're coming together. Plus whatever was happening before, for example, dengue. I think that kind of idea that there are all multiple hazards because there are these multiple times. Very sudden disaster, also the middle and in the long.
I guess just to approach it, I agree with what the panelists said, just to approach it from a different dimension. Also, I think of it from like a solutions angle. So if something like green infrastructure, tree planting, which is sort of in vogue with our city partners at the moment. Even there are so many trade-offs there, whether if you take like a One Health approach, you can start to tease some of these things out. There could be benefits for food security, but there's also prevents and for heat, obviously, and shading. Some challenges though from aeroallergens. You could have higher densities of disease transmitting mosquitoes. There's a lot of dimensions that one has to consider: hydrology, maintenance costs for the owners, people's previous histories of surveillance, and communities wanting trees or not. So it's such like a fascinating way to start to think about these. That I think the more that we can do that holistically, the better.
Thank you.
But this is a curiosity question for Chris. So is there a reason why you're not incorporating high resolution weather models and reanalysis, or I'm sorry if I missed it. Is it that at 3 or 4 kilometers resolution, that's just not a high enough resolution to get the gradients, or is it because it doesn't actually do well enough compared to the monitors to get the urban, rural, or urban, less urban gradients?
Yeah, great question. I think it can be done with reanalysis. I have more confidence speaking to, but I think it can be done with reanalysis to bias correct it. And that's probably the easiest way to create a domestic or global version of that. But yeah, in terms of the numerical models, my sense is, my limited understanding of this is that, right, you essentially might need to nest even like an urban canopy model within a award for a mesoscale model to even get at more sort of those effects. But so perhaps complexity.
Any questions?
I have a question for Susana and maybe Chris as well. So Susana, you showed a map where on the one hand, it was a 4-kilometer gridded satellite product, and on the other, it was mapped to census tracts. Chris, you showed 5-kilometer gridded data. I'm wondering how much of a burden is it on you to convert from the kind of NASA gridded products to these census tracts ones? And if it's a burden, how do you do it? Thinking ahead as if maybe this is something we could have scripts to do in-house.
I'm not an expert on the grid, but what I do know is that you need to decide how exactly you're going to grid the data and what you're going to grid. And it's not the same to do a gridding of absolute number that is to do an average. So you need to the 4-kilometer grid to a census tract, how exactly you want to do. The procedure is not, I mean, it's just, you need to decide what you want to conserve and what you're going to lose. You're doing that. So you're averaging, so you are missing the that you can have in that particular one. So that's one of the risks of doing this. And you need to be sure that what you're doing is something that can actually be gridded as an average or as a sum or as aggregate. That's for me the consideration that you are not losing important information when you're doing the transformation. And the similar when you have very detailed census tract, but you need to aggregate very coarse. So you have always this trade-off, and you need to decide what you're going to keep and what you're going to be losing.
Sure, great question. Well, at least one point, the EJ Tiger team, Susan, Tracy, Kian, and others, I'll let them speak about it more, but I think they did come up with a bit of a tutorial to try to convert. But I agree, this is still a long that's like one small thing, and like NCAR, UCAR has a tool that you can, it's an ARC plugin, but still, it's going to still be a major, that's like a small chip in the iceberg of people not understanding 3-dimensional data, or even for health, like maybe for some studies, census tracts best, some for health, oftentimes we can only get the zip code, 5-digit postal, so kind of right. But I think there can be a way for us to do that in house, and that'd be awesome.
One more thing. Also, it's important to be very clear what was the original information, because you can have a higher resolution when you use census tract, but your input data is the same. So you're just repeating the information. That's another thing to consider.
I have another question. Let me, so for those of you working with states, one thing that I've been really scratching my head about as the Justice 40 initiative has kind of gotten its legs and started spinning up operations is how we're identifying disadvantaged communities. And right now, it seems to me that the way that the National Justice 40 initiative is working is that there's a national standard being applied to all census tracts. And you have to meet a certain threshold for national level of poverty and national percentile of various hazards, like PM 2.5 is one of them. And I'm just wondering for, to address public health, we do need federal action, but we also need local and state action. And it could be that using these national percentiles is not actually aligned with, the communities that the state and local agencies feel are the highest priorities to address from a public health perspective. So I'm just wondering what your thoughts are in terms of using this like national percentile approach for the federal government and how that aligns with state and local priorities.
That's a really good question. Yeah, I mean, I guess states really know what they're observing, and in our state, the climate data is just one facet of the data we collect, and we've got a lot of data on a whole host of health outcomes. Substance use and abuse is huge in New Mexico. There's high rates of suicide. There's a lot of other factors. So I think we really have to kind of balance the climate aspects with those other needs in the communities because they are so high. And honestly, in New Mexico, climate health is not at the top of everyone's mind. It's really, it takes a backseat to so many other problems. So yeah, I mean, it just kind of have to work with this within your system and try to work it out.
I think what you just said is very important because the dynamic between different groups is very different. And I think that's something that needs to be considered. So what happens if you are like 1 decile on top and 1 decile below? You have a very homogeneous population in terms of race and ethnicity, but there are other factors mentioned that are very important in order to determine vulnerability in certain specific characteristics. You then need certain flexibility on that. So the national level is masking a lot of subnational level situations that are not tailored to those national.
Those of you who work with me know that I'm always full of questions. I have many more, but I want to give opportunities to you all too.
This is Yang Liu from Emory University. I have a question for Stephanie. So I, after so many rounds of HAQAST meetings, I have this impression that we now have plenty of, exposure data. There are multiple sources with different types of, resolution, uncertainty estimates, different caveats, but we have a bunch. And like Daniel's presentation, it seems that the impacts, the consequences from being exposed to these risk factors are sort of understudied, or and I feel like one factor is the challenge in accessing health data. I know the health data is there. There's a lot of electronic health records data, but it's very challenging due to privacy, confidentiality concerns to make this kind of information widely available for researchers to dig into. Any thoughts on that, and any possibilities or options? Any suggestions to make that a little bit easier for academics or researchers?
More accessible. Gosh. Well, everybody's got to go through IRB to access data, and it is a challenge. One thing that we're starting to use in New Mexico is syndromic surveillance data, which is through the National Syndromic Surveillance Program. There's a data portal called BioSense, and those data are near real time. They're not high quality in terms of, you know, being clean, but it really gives you a sense of what's going on at the moment. And so we're trying to take a look at that, especially for like heat health outcomes. And we're also looking at it for asthma. And hopefully that type of data would be more, will become more and more available, and the quality will improve over time. But I really think that it's a challenging way to go, but it could really kind of answer some of those questions about, you know, how do we get the data? So take a look at the NSSP.
I want to add one point to it. I think it's an interactive process. For one, is the data is there, it's not easy to get. Another one we should make is, I mean, loud and clear that we need the data. We want the data to be more accessible. So in the case I was studying the dust fatality, I find that for some states, they have very good record. When the state police were training, they actually tell them how to document weather type and put the dust as one of the types. But in some states, we found that they actually do not have that requirement. So, you know, I think one thing we are trying to do, be more proactive, is just to find a way to talk to the state police department and ask them to provide more abundant or adequate training for their workforce. And they can provide the information that we need to have a better mapping of the, you know, the hazard damages for the population. I don't know about this for the health data. If we make a request for our voice be heard.
We can try. Sure. I mean, it is a challenge for sure.
Great talk. What I wanted to note is that everyone today mentioned infectious disease in your talks at some point. I know Stephanie initiated that, you know, you're collecting the data, but you know, it leaves just kind of at the surveillance level. And Daniel, you have extensive work with valley fever. Susana, you mentioned, and as well, Chris, both mentioned infectious disease. So what I'm wondering is, of course, there's a lot of global work right now with heat health, which is of increasing importance. But what I'm wondering is if you have any recommendations as next steps on how to best connect heat or other extreme events to infectious disease, especially when we think about research or community applications, of course, that align with local and state priorities.
Well, so we were actually doing some studies on valley fever in particular, and that got gobsmacked by COVID, of course, and so now it's, you know, our IDEPI bureau is really still bogged down with that, and then monkeypox and et cetera. But I think we just need to really bring some awareness about what the diseases are, and just states need to focus on what their patterns of disease are. I know in New Mexico we've got, I mean, the hantavirus is where it was discovered there, and actually is what brought me into epidemiology. So the surveillance helps, but I think we need studies and perhaps to work with universities more closely to really map out what's going on.
I had the opportunity of working with a group working on HAQAST disease. And from that, all the experience of working with the neglected tropical diseases. So there is also an element that these have been diseases that have not been paid attention because they're affecting most of the more poor and isolated populations. But the changes in weather are changing the back. And there are more studies, they are increasing, but they're still not really there. But they are more interested in looking into that for the whole and institution to pay more attention. So that is very much linked also to mobility, because the diseases are being spreading because they're not being. Yeah.
Yeah, awesome question. I mean, like on one level, the exposure risk side, whatever you want to call it, they're very divergent. But if you flip it, if you look at the humans first, there's so many overlaps in terms of right in high income nations, people spend 90% of their time indoors. And that's sort of our starting point. And so and if I think that sort of the indoor-outdoor relationship, or how much time am I spending outdoors to be exposed, whether that's to a vector or something else. Right. Getting at that question is really important for everything that's been mentioned: air quality, heat, and then sort of how is that indoor environment modified, whether that's air conditioning, so activity patterns, built environments, I guess housing justice. Like from that angle, I think they're all really quite related.
Yeah, I agree. But I think that's really is a very good question. There are two parts of it. One is at the end, the action or service agencies, they have to make a decision to protect human health, public health. On the other side, we also need scientists. We all need to generate enough information to inform decision making. I would just take a valley fever, which is a topic I have been working on for quite a while. As an example, I think we know, we have been studying valley fever for decades, but we know very little about it. Very fundamental questions not answered. For example, where does the fungus live, right? And how does it get transported into the air? And how do people get exposed to it? And how do you stop that? So those process level understanding is lacking right now. And as such, we cannot put out a very good policy. And right now, the best public messaging people having is on windy days, stay inside. Right? But you can actually, not so windy days, you can get out and get infected. Right? Because we do not know, we do not have the answer to those fundamental questions. I feel like to answer your question, should move in on two fronts. One is really get into a deeper understanding of the process, the physical process, chemical process, and the biological process. And then use that information to inform decision makers. And so we can have a robust policy to work with society.
If I could just ask one follow-up as well, that was a good segue, Daniel, because mostly to you, but to others as well. I know you've been working on valley fever for quite a long time. It's been really interesting work and eye-opening. I was surprised when I saw your map of the Americas to see valley fever show up in so many different places. And I am also aware that there's other fungal spores of different types that are endemic in the soils in the US and elsewhere in the world. How well do we understand the impact on other types of fungal diseases? And also, I guess also more broadly, like there's a whole microbiome of the air. Are we really only scratching the surface right now?
I think you're right. It's actually a very big question. I don't think I can answer that. But I can take a valley fever as one example again. So traditionally, people thought valley fever is a problem that only live in Arizona climate zone, right? But a few years ago, CDC identified a case in Washington State. That was like a really big news. People are really trying to scratch their head to figure out why. And the boy crashed into the land, was riding a dirt bike. He hurt his knees, and his knees touched the soil, and that's how he was getting infected. USGS actually went to the soil and then did a sampling, and they found a cocci fungus in the soil. So now we do not know how wide the fungus has been spread, or they have been always living underneath us. It's just like we didn't figure it out. That's another factor is climate change. What climate change will do? I think for most of carbon life on Earth, right, we are triggered by two things. One is temperature, and another one is moist. If moisture and temperature will change, that's going to change the dominance of different life forms. So back to your question, I don't know how to answer that question, but I think definitely you should put a climate, put the biosphere into the picture when we talk about public health. I don't know other panelists.
Any other questions from the crowd? I'm going to take moderator liberties and ask one final one then. We, I think, are getting pretty good at providing spatial data, as we've heard, throughout this meeting and previously, and also communicating that information to different audiences. But I'm wondering if there's specific vulnerable populations that we're not doing as good a job as we could in terms of communication. And in particular, I'm wondering about, maybe this is Stephanie, I could put you on the spot first, if you're willing. Specifically, I'm thinking about patients who can't take the precautions that we typically communicate with, say, air quality alerts or heat alerts or things. Maybe they can't stay home and stay inside. They have to be at a job, or they have, some sort of medical need to go to a dialysis center or something like this, and can't take those precautions. Are we communicating the messages that are needed to be able to protect these vulnerable populations?
No, of course. It's really tough though, because people do have awareness. They know. It's when during the COVID pandemic, we all were recruited to do case finding and case communication. So I spoke to several folks who, they said, well, I know I can't just stay inside. I have to go. I have to take my grandmother to dialysis. I have to do this. There was just, it wasn't, and then people got really resentful. And because there was a lot of mistrust and a lot of misunderstanding. So climate is no different. It's going to be challenged. People are going to think that there isn't a problem when it's pretty much in front of their face, which is kind of tough because they don't really see the connection always. It's kind of like guns, it's like, yeah, it's the guns, right? So we could do a much better job. There are one particular community that I think really gets left behind are the disabled. And we just don't take them into consideration when we're making plans. When we plan for heat centers or other methods, we're just not thinking about them when we set up plans. And rural communities are the same. It's just, there's a lot of focus, and I love the New York studies, but our census tracts encompass multiple counties, which are huge. So what works in one place won't necessarily work in another. And we're trying to work through that, but we definitely need to take all those into consideration.
I want to go back to what you said about the census tract, because it's true. The census tract are great in urban areas because they're small, because they're based on population. They're very large. Maybe using a different approach, like a population center or a block group could be better. But there is those different characteristics that in terms of being good, I think that we understand the map, but maps understanding is very personal. So how you understand the space is very much linked to your experience, and the maps are in general very up. We are putting a lot of information in the map. So I think it's important. There are a lot of exercises that have been done with community mapping, mental map, to help others to understand what exactly people that are not specialized in the field see in the map. And I think that something that also needs to be considered. What is important and what is not. What is a reference and what is not in those persons.
Sure, yeah, completely agree with the panelists. Other things, outdoor workers, there's about 5, depending on how you count, 5-ish states that have standards for safe work to rest, ratios for outdoor workers and provision of water, rest, shade. But somewhat strangely, like there's actually fewer for air pollution. And if Caitlin Odell, she'd be happy to tell you more. It's more her jam. But nonetheless, which is surprising to someone who does health. Other ones, LGBTQIA+. These other communities that we actually are hard to count, undocumented communities, are ones I'm thinking about more recently. Yeah, LGBTQIA+, in spite of perhaps sort of popular representation, they are more common, more likely to have adverse impacts during disasters, to be unhoused or unsheltered, and a variety of other mental health and history challenges.
Well, I think I've always thought that blending our very intense quantitative information with the lived experience is both a challenge and opportunity, maybe a next new frontier for this community. So good note to end on. Thank you so much to our panel. Round of applause. Excellent presentations. And we will move into a break for 15 minutes. Thank you.